ACell and PRP treatment for transgender people with male pattern baldness? I have been looking for articles that may reference how well ACell plus PRP will be affected by any combination of hormones or balancing. My theory is, when it comes to ACell and PRP, for a person that has near zero testosterone after hormone therapy, it may produce near permanent results. This is if the male pattern baldness has stabilized and improved, testosterone DHT has been reduced, and the individual's estrogen levels are brought to around 200. I would love to hear feedback on this.
Thank you for your question. You're asking an interesting question because you're stating this hormonal manipulation for the purposes of transgender pursuit of balancing, where you feel that with the hormone levels of testosterone being virtually zero and estrogen levels of being close to 200, and that a treatment like ACell plus PRP could result in permanent prevention of hair loss. Well, certainly I can share with you my perspective with my experience with ACell and PRP and treating both male and female pattern hair loss. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I'm also the founder of TrichoStem Hair Regeneration Centers, where we have created a system using ACell and PRP in our own way that helps people non-surgically suffering from male and female pattern hair loss. So when it comes to basic understanding of the effects of testosterone and hair loss, it brings us to the knowledge that we have about DHT, or dihydrotestosterone. Understanding that DHT-sensitive hairs can be affected by elevated DHT levels. Therefore, a drug like finasteride, which lowers DHT levels, or through effectively, whether it's surgical or chemical castration, eliminating testosterone altogether, no testosterone or lower testosterone results in no or lower DHT. Now, it is known that in that scenario, men will not lose their hair, but the question remains as to the longevity of that when it comes to the situation in a transgender situation with a genetic pattern loss that is present. Now, understanding that androgenetic alopecia has not only DHT as the only cause for hair loss. We've realized that essentially by what we have observed. About 7 years ago, when we were developing hair regeneration, the treatment we have for hair loss, we were using acellular matrix and PRP to help people undergoing hair transplant, and saw this interesting side effect. What we can at least establish to this point is that people who are not taking finasteride, which means they were not taking a DHT blocker, as well as women who have 1/6 the testosterone of men, will both respond to treatment with ACell PRP combination in the way we were doing it and have been doing it, but we can only state this for at least 5 years. We can't say that it's indefinite. What we're talking about is a theoretical potential benefit, but however, what we can at least have to understand, and the way I try to distinguish it, is this way. When we look at DHT, I think of it as something that is, which is affecting in a toxic way the progression of hair growth. So, in a way, DHT is inhibiting hair growth. Take away the DHT, and the hair should grow. However, when we look at people taking finasteride for extended periods of time, they can still lose hair. which means that it depends a lot on the relative DHT sensitivity, and there are other genetic factors that may be also responsible for hair loss progression, which means that you can still religiously take your finasteride for 10 to 15 years. You may have slowed down the progression, but you may not have, you're not able to stop the progression. Now, when we're talking about this hormonal situation, yes, you might be on the right track, but I would also propose to you that when we're treating women, and women don't take finasteride, or not, it's generally not recommended, since we don't believe that really it's the androgen sensitivity, even though some doctors will try a trial of finasteride for women. But generally speaking, female pattern hair loss, although it may look similar to male pattern hair loss microscopically, we don't treat it the same way. We're able to use hair regeneration effectively to treat female pattern hair loss, again, stimulating regrowth of hair that's not growing, prolonging the growth cycle of existing hair, inducing the shed of thinning hair so that thicker hair grows in. But again, with our data, which began 7 years ago, and aggregate overall the largest numbers, we have 5 years of data showing improvement and stability for over 99% of patients. So when I discuss the treatment plan long term with our patients, I say that essentially there may be a value to a sustaining model where you maybe come in every 5 years to get an injection to see if we can keep boosting the growth of hair. There are a lot of things that happen every 5 years, particularly depending on the age of onset. When you think of, I look at a lot, because I'm a cosmetic surgeon, I look at many parallels between how the hair behaves on the scalp and how skin and soft tissue behaves on the face. And so when we do PRP on the face, and we do this to help improve skin quality, to improve fine lines and wrinkles, to improve dark circles, to improve acne scars, we know that we want to treat and we're kind of mitigating or managing a genetic progression of tissue loss. So in a way, I feel like there is still some intrinsic benefit in improving the skin quality of the scalp with ACell and PRP, basically based on clinical observations. So depending on how your hair behaves, I think you can certainly explore having this treatment to maximize your hair growth if you have experienced any hair loss. But as far as permanence is concerned, I think that's a question that only will be resolved with longer term use. There's a lot of theoretical ideas, and there's a lot of conceptual theories about how these things work. This is the challenge of clinical medicine. There's a lot of theories, but sometimes we don't know exactly why something works. And yet we do use these technologies because we observe that they're safe and that the clinical outcomes are positive. So consider this, and certainly don't stop doing research and don't stop asking questions, but don't make any assumptions. I think it's very important for your own health, as well as the ongoing goal of retaining your hair, to keep your eyes open and to consider this concept of doing a treatment such as hair regeneration in a sustainable way. But when you think about having an injection done, let's say, every 5 years, that's pretty sustainable, and I think that it is likely to be more practical than it is to assume that there will be permanence. The reason I say that is that I tell my patients that I don't want to wait to see them lose hair before I do another treatment. I want to try to stay ahead. So it is certainly a challenge when you do something that's an innovation and that's really a development of a new category. But as long as we try to adhere to quality of data and making good observations, I think we can only gain insight with time. So I hope that was helpful. I wish you the best of luck, and thank you for your question.